welcome to Medical Dialogues, your daily dose of health and medical news. I'm Roshni Dhar. Let's look at today's top headlines. MBBS BDS degrees from Pakistan not valid. Through a recent notice, the National Medical Commission has warned the medical and dental aspirants against taking admission in MBBS BDS courses in Pakistan. Issuing a public notice in this regard on 28th April 2022, NMC, the apex medical regulator in India, has mentioned that the MBBS BDS graduates from Pakistan will not be eligible to appear in the FMG screening test and practice in India. This comes shortly after a similar warning had been issued by the Dental Council of India a couple of days back. Around 889 seats vacant, doctors urge Health Minister to lower NEET assess cutoff percentile. Referring to hundreds of vacant seats in the super specialty courses, the doctors under the umbrella of Federation of All India Medical Association have written to the Union Health Ministry seeking a reduction in the cutoff percentile for NEET SS 2021 counselling. The doctors have pointed out that with the current cutoff mark of 50th percentile, a lot of doctors will be unable to meet the cutoff criteria, resulting in huge vacancy. 25% reservation for doctors after 3 years rural service in Maharashtra. With an aim to ensure availability of specialists in the rural and tribal areas, the Maharashtra government has introduced 25% in-service reservation in PG medical admissions in the state. The medical officers employed under the State Health Department will now be able to avail this reservation benefit after completion of at least 3 years of service in the rural and tribal public healthcare centers. The government took this call in a joint meeting held between the Maharashtra Public Health and Medical Education Department. Deputy Chief Minister Ajit Pawar chaired the meeting. Confirming the news, the State Health Minister Rajesh Tope mentioned on Twitter that the government has decided to reserve it for the medical officers of the health department. At least 3 years of service will be the condition for the reserved quota for the postgraduate degree under service. Kidney stones in teenagers caused by lifestyle changes, said experts. The kidney stones generally observed in mid-ages due to accumulation of calcium are now observed even at younger age. The primary reason for the phenomenon is obesity and lifestyle changes, said experts on the inaugural day of 3-day 5th Advancements in Andrology 2022 that started in City on Friday. Dr. Kandar Parekh, organizing chairman of this event, he said in the past few years we have witnessed strides in fields of minimal access surgeries, flexible uteroscopy, bipolar TERP, HOLIP and etc., many of which are now used extensively in India. Earlier cost was deterrent, but now the difference is not huge. Organizers also added that summer is often considered season of stones due to dehydration. Drug safety alert, IPC flags adverse reactions linked to Cefuroxime. The India Pharmacopoeia Commission, through its recently issued drug safety alert for the month of April, has revealed that a cephalosporin antibiotic, Cefuroxime, is linked with drug reaction with eosinophilia and systematic symptom syndrome. This came after preliminary analysis of adverse drug reactions from the Pharmacovigilance Program of India database. Cefuroxime, like the penicillins, is a beta-lactam antibiotic. By binding to specific penicillin-binding proteins located inside the bacterial cell wall, it inhibits the third and last stage of bacterial cell wall synthesis. Cell lysis is then mediated by bacterial cell wall autolytic enzymes such as autolysins. It is possible that Cefuroxime interferes with an autolysin inhibitor. That's all for today. Stay safe.
Never miss a medical update from Medical Dialogues. Like, subscribe, and press the bell icon.